everybody. Erica Howe here. Welcome to The Medical Educator. You know, I've been teaching a live teaching skills and faculty development course for close to a decade now. And there's one common theme every time I teach. Clinicians coming up to me and saying, "Hey Erica, your course is great. I love it, but I just can't come to all of those sessions because it doesn't fit well into my busy clinical day. Could you maybe teach early morning or late at night or even on the weekends so that I could come more often?" Well, the Medical Educator is the answer to that question. The Medical Educator is an all online, on-demand teaching skills course and set of resources for anyone who wants to get better as a medical educator. So today I want to give you a little taste of what one of our typical webinars is, but I also want to respect your time, so we'll try to keep it really short. You'll notice that this is not your father's PowerPoint presentation. Things are a little different here at the Medical Educator, but I think you'll enjoy it. All right, let's get started.
Today we're talking about engaging the unengaged learner. Now, when we think of a learner who seems unengaged, likely many descriptions can come to mind. In general, when I've polled faculty, they say that an unengaged learner is a learner who seems distant, both physically and emotionally, somebody who may be quiet, doesn't make good eye contact, is slow to answer questions or avoids them entirely. Now, certainly more can be added to this list, and we have to recognize that these descriptors depend greatly on both the learner who seems unengaged as well as the teacher overseeing them and their interpretation of the behaviors that they're seeing. Which brings us to our 6 main strategies for engaging the unengaged learner. Number 1, don't judge a book by its cover. Now, this seems obvious enough, but we need to acknowledge that the appearance of disinterest can be very different from actually being disinterested, especially when it comes to millennial learners and technologies like smartphones that can make it hard for faculty to decipher whether someone's paying attention or not. As we teach to generations of learners that are more and more accustomed to a constant barrage of information at their fingertips, as well as nonstop connectivity with others through these devices, what appears to be disinterest from learners can simply be your learners accessing information in real time to improve their knowledge base or to participate more actively in a discussion that you're having. We talk more about this in the webinars on preventing the difficult learner and treating the difficult learner, but this is a good time to explain to your learner how they appear and how you're interpreting that appearance, and also ask questions about how they're doing if they feel unengaged or challenged by the teaching that you are providing. Now, this leads me to tip number 2. Clarify how you define engaged and what does that look like to you, then inform your learners of it. Now, it's important to reflect on what an engaged learner looks like to you specifically, especially because this may be different for different teachers. What are the actions that relay interest and motivation in your eyes? Staying with the group, eye contact, asking questions, really think about those actions that express interest and those that don't. Then you need to inform your learners what engagement looks like to you. Now, you need to remember, when expectations are not laid out, our learners will make assumptions about how they are expected to behave and act based on prior experiences. And studies have shown that the learners' expectations are often incongruent with the expectations that we actually have of them. So you need to let them know what you're thinking. Number 3, give specific, action-oriented feedback that ties back to their assessments. Now, most learners want to impress you, but just don't know how, and maybe they're frustrated along the way. They're looking to you for that guidance. Now, this means committing to feedback beyond generalized statements like, "I need you to be more professional." This means pulling out their evaluation forms and showing them how their behaviors and actions fit into the categories of honors, pass, and fail. Better still if you have entrustable professional activities, or EPAs, to guide your feedback, since these lay out a scalable progression of directly observable behaviors that our medical learners are expected to successfully perform as they progress through their training. Tip number 4, learn more about them. What are their interests? How can you relate what you're teaching to what they need to know, to their career path, even if it's different from your own? I'll give you an example. Now, I often teach about the differential diagnosis of a common symptom in internal medicine, syncope. And I start by sharing a story that actually happened to me once. I was flying home from a vacation when a guy sitting next to me noticed that the flight attendant was getting out a stethoscope. Now, as you and I both know, flight attendants do not just get out a stethoscope in the middle of a flight for no good reason. A few minutes later, they called for a doctor, and I went to see if I could help. It turned out that there was a lovely older lady who had passed out. Now, as a hospitalist, this is a very common symptom for me to manage, and in this case, it was a simple case of dehydration. But what I later discovered was that syncope was also a very common occurrence as a medical emergency on planes, accounting for up to half of all aircraft emergencies. And that as a medical professional, there is also a decent likelihood for my learners being involved in treating one at some point in their travels. Now, the second act to this story was that a couple weeks later, I received a letter of thanks from the airline for my management and a gift certificate for a free trip, which ended up subsidizing my next vacation. So when I teach syncope, I always make a point of telling that story and telling my learners, hey, even if you're not particularly interested in syncope and don't plan on going into internal medicine, where you'll need to use this knowledge on a regular basis, this is good information for you to have in your back pocket, because you never know when it might be the medical knowledge that helps somebody on a plane one day and makes you look like a rock star in the process, and possibly even get you a free airline ticket. This story leads me to my next point. Personalize the knowledge that you're trying to teach with storytelling. Now, this concept is also known as narrative-based teaching. It gets at the principle of using stories to embed the facts that we're trying to impart into either a larger or a more personal context. Now, this can help the unengaged learner understand better how the knowledge that you're trying to impart applies to them and their career. Storytelling has also been shown to pique interest, increase motivation, and lock in new knowledge into the long-term memory. Now you may say, but Erica, I don't have any stories to tell. Well, if you're struggling to remember a good story, I want you to ask yourself 3 questions. 1, when was the last time I made a mistake, and what was the learning point? 2, when was the last time I really saw a great result in catching this diagnosis, and what was that? And number 3, when was the last time a patient presented in an atypical way with this diagnosis, and what was it? Now, these 3 questions can help you recall a memorable patient or case to teach from moving forward and help you build on that storytelling. Number 6, ask the learner to pick a topic and teach it back to you. You can start to understand more about what topics in your field that learner is interested in, as well as how they like to learn that material. In them choosing what to teach and how to teach it, you'll be able to see what interests them and how they best master that material so that you can teach it in a similar way moving forward. Now, at the same time, this acts to put them in the driver's seat, giving them autonomy in the educational process, and that can increase their investment as well as their interest. Also, ask them how they would apply the topic that they're teaching moving forward. Ask them to think about how they could picture themselves using that information in a clinical scenario so they can put themselves in the driver's seat when it comes to application. All right, those were 6 strategies for engaging the unengaged learner. I hope you found some really valuable tips and tricks to engage your learners and motivate them moving forward. Thank you for joining me today at The Medical Educator. We'll see you next time.